Dr. Malte, if you would be so kind as to talk about some of the things that I know, with all of your expertise and what you've brought to the area, what are some things that are going on that I know there are in progress and that you're building within Baxter Regional Medical Center?
Yeah. So the number one thing that I'm very excited to build is a pulmonary hypertension center. Right now, the Pulmonary Hypertension Association, which is known worldwide, is trying to develop accreditation for hospitals to be centers for referral for patients with pulmonary hypertension. Obviously, this requires a lot of facilities, requires a lot of logistics, which we are able to set up here at the Baxter Regional Medical Center. So
see, that's awesome to me. That people, you know, we are this rural hospital, but we have so much technology, so many great physicians, and we've got the capabilities because of the great physicians to go ahead and do this. So, not to interrupt, but I wanted to,
I'm actually very excited about it because we do have, what we need is for primary physicians to understand when it would be time to refer patients to these centers. Unfortunately, right now as it stands in the entire United States, people with pulmonary hypertension get referred to specialists late in their disease, which is unfortunate because there are new therapies that have been developed for these patients. The therapies began developing around the 1990s and have bloomed progressively in the last few years. We are able to give them medications that can even prolong life. So those are things that we can offer if they are diagnosed early.
That's the key to all of it.
That's right.
I know with the Super D that we'll be rolling out, and with lung screening and all of that's coming in the very near future. We already have the Super D and Super Dimensions, and boy, oh boy, if you can get in there and diagnose at stage 1 for lung cancer versus stage 4, there's no comparison.
Right.
You know, one you're stage 4, you maybe 5 more years to live.
Right.
And stage 1, you can have a great quality of life and a much longer one.
That's correct. Yep.
Yep. I love that you're all excited about this and want to get this going, and and it's something. It sounds like we'll be cutting edge as well.
It will be.
Yeah, which we've been for other things. Our 3D tomosynthesis in our breast imaging center, we were one of the first in Arkansas and Missouri, but also one of the first in the nation to have the mobile mammography unit out on the road.
Yep.
So with all our 3D equipment, and which diagnoses breast cancer much sooner than regular 2D. So,
that's right.
But so how would you go about this? How would this whole process work?
So it would depend on the certain disease processes. So obviously for pulmonary hypertension, for instance, if a patient comes into a primary care physician complaining of shortness of breath, unexplained shortness of breath, or maybe syncope, which means passing out for no particular reason.
Really? Okay.
Yeah. Okay. Or having chest pain or palpitations that's unexplainable.
Because they probably eliminated, first thing they probably do is go have them do all the heart stuff, all the cardio stuff.
Exactly.
Once that's eliminated, this is a good area to look in.
This is a good area to look into. And if they have liver disease, that's probably something that's particularly even more interesting, because there's a particular group of patients with pulmonary hypertension associated with liver disease.
Liver disease.
So if you have liver disease, any connective tissue disease like lupus, or even if you've had HIV or diagnosed with HIV and shortness of breath, you may want to be referred to a specialist to see if they may have underlying pulmonary hypertension.
Right.
Then the workup that we do here is pretty much bread and butter anywhere else. So you do a pulmonary function test, which is a breathing test. We also check if you have clots in your lungs, which we do a VQ scan, or it's a nuclear scan, essentially.
Is that done? People hear nuclear and they go, okay, I'm going to glow in the dark. How is that done?
So it's almost like a CAT scan.
Okay.
There is no contrast involved, so there's no very, very small risk to
so they're not drinking anything?
They're not drinking anything,
to show up, okay.
Exactly,
okay.
Yeah. And that could be an outpatient procedure as well.
As well, okay.
Yes.
Okay.
And if all that comes negative, then we proceed with a right heart catheterization in the cath lab.
Okay.
So the cardiologists here, including myself, are able to do the right heart cath procedure. And from there, we can actually confirm the diagnosis of pulmonary hypertension. Then we can start treatment.
Treatment, okay.
That's correct.
Okay. Sounds like there's a little bit of a process involved.
There is a process.
To really get to the
Yes.
final diagnosis, and from there, you know, treating. So,
Yes.
but it's a lot of steps. Are there a lot of, how would I ask this? Are there a lot of diseases out there that basically mask each other? So in other words, shortness of breath, most people would immediately think of, and they might think of the lungs, but they might also, when you talk about fainting, that kind of thing, they might think of the heart first.
That's correct.
Yeah,
Yes.
versus the lungs.
Yes.
So,
And it could be very well be true. You could have shortness of breath with fainting because of irregular heart rhythms.
yeah,
Or you can have shortness of breath and fainting because you developed a clot in your lungs, which
Yeah.
is called pulmonary embolism. So those are the things, those are fatal things that we watch out for. But obviously when you have these things also, you also can consider pulmonary hypertension at the back end.
At the
Obviously
back
the
end,
first
okay.
two, heart and the lungs, they're always the primary things to look for.
yep. Check those out first, make sure that they're working well, and if that's not the case, go looking further
That's right.
for what you're talking about today. This is great.
Correct.
What great stuff you're bringing to us today.
Yep.
And so this is something, this is an ongoing, just getting off the ground project, and
That's
going to be
correct.
ongoing. And
It's going to be ongoing. We're
yeah.
working actually with drug companies because the medications for pulmonary hypertension, they don't come cheap. I can tell you that.
Okay.
However, having said that, there's a whole array of resources for patients to even get these medications cheap, if not free.
I know though so many of the drug companies have really been awfully good about working with us and working with our patients, that low-income families, this kind of thing, that need it, as you said, sometimes even free.
Right,
So
yeah,
it's
and
just-
it really helps a lot.
Yeah, and we've always got the resources. I need to let people know that as well. We've always got the resources at the hospital. We have people that can help you find out about various medications and,
Yes.
and the manufacturer, and to see if they will in fact work with you and provide those for you at no charge or a minimum cost.
Right.
So,
Yep.
yeah, anything that has to do with healthcare has got that price tag on it, I'm afraid. So,
Yes.
but
But the exciting part is, at least in the pulmonary hypertension end of the spectrum, we've had patients who really don't really spend as much. Some of them don't even spend anything for the medications, which is great.
that is great.
Yep.
That is great. And most of all, it all comes down to the quality of a person's life and the person's life. So,
That's correct.
you know, make sure that everybody has the best quality that they possibly can for as long as they can. And that's just what we're here to do. So, and I know that's what you love doing with your patients each and every day. So.
That's correct. Yep.
Yeah, I know you do. Well, will you come back and join us again real soon?
I hope so.
I
if
really
you'll
hope
invite
so.
me again.
I will invite you absolutely anytime, and I would love to hear. I really want you to come back and talk about how we can go ahead and where we're at as far as progressing with having the primary care physicians referring patients to you, and then everything else that you're
Yep.
building. So,
Correct.
you're just out there. Yay, go get them, Dr. Malty.
Yeah.
Thank you so much.
Thank you
Come
so
and
much
see
for
us
having me.
again.
Yep.
All right.
Take care.
Thank you so much for joining us today for BRMC's Healthy Connections. We'll see you again next week.